Welcome back. Being pregnant and having a baby can be very exciting, but sometimes the changes that come with this time can also leave women feeling sad, guilty, overwhelmed, and anxious. And today we're going to share one woman's personal story and tell you where to find support too. Sarah Bloomquist is with Mom's Mental Health Initiative, and Heahter Nischke is with Postpartum Support International. Great to see both of you ladies. Thanks for joining us. First of all, just how serious this is, because I was shocked. You told me before we started that suicide is actually a leading cause of death for women after they've had a baby.
Right. So we're looking at statistics that say about 1 in 7 women will experience a perinatal mood or anxiety disorder. So that includes pregnancy or postpartum depression, anxiety, OCD, panic, PTSD. But that's just what's being admitted. We think it's closer to 1 in 5. And we're also seeing that suicide or death by suicide is one of the leading causes of death amongst postpartum women. And it doesn't discriminate. So it doesn't matter who you are, where you come from.
It
can affect you and your family.
A lot of people. Mm-hmm. What causes it? Do you know?
The hormonal shift, the lack of sleep, all have factors. If you have mental health, like history, anxiety, depression throughout other periods of your life, put you at more at risk. I think the lack of societal support for new families also plays a role.
I think there's some shame too. I had postpartum depression after my oldest daughter was born. I think it's really common. I thought, well, I'm educated. My doctor was aware of it. Nurses talked about it. I had a good support system, and it can still happen because I wonder, why aren't moms getting the help they need?
Right. It doesn't discriminate, like we said. So you can have all the everything in place to have a baby and not certain stressors that could trigger it and still get it. Or you could have all these stressors and not get it. So there's a lot of factors that can play a role. But the shame is just kind of the overall shame that we deal with anyways with mental illness. You think, I should be able to handle this. I should be tough. I'm a mom. Why am I not enjoying this time period? I'm not going to speak up because people are going to think I'm a terrible mom. And what we hear a lot of moms saying then is, I should have never become a mother. And then they also think my family would be better off without me. And it's just heartbreaking because this is the time where you shouldn't feel that way. And it's not true. And that's one of the things that we are always telling moms. Those thoughts are not you. Those thoughts aren't your heart. It's the disease.
You have 2 children,
correct?
Right? Did you have postpartum depression with both of your children?
Yes, I had postpartum depression and anxiety with my first, and it hit me acutely in the hospital. And then the second time I had it with my daughter, and I did treat it immediately. Actually, I was on medication, and then with medication changes, it kind of reared its ugly head. But I have the biological factor. It runs in my family. And so I knew how to combat it. But even in the midst of it the second time, I kept thinking, I just got fooled again. Why is this happening to me? Was I supposed to have another child? So it really messes with your brain, and it's extremely agonizing, and you feel very alone.
And I can see for you, for me too, I feel like you have to get many years sometimes beyond it to have perspective and to be able to help other women as you are doing. Why this is so important. Why is it so important to get moms the help they need and treat this problem? Because a lot of people will say, oh, it's just the baby blues. It's normal.
I think it's important to get help as quickly as possible because it will impact the bond that you're creating with your child or your older children too, who may not understand the new sort of dynamics that comes in as you're adding children into your family, and it can really just upset the entire experience.
Yeah, we're seeing that kids are extremely affected when their moms are left untreated, and we know a very small percentage actually do get treatment. So when a mom is not treated, it can affect her bonding. It can affect the way her child way she interacts with her child, and then we're seeing more neglect, we're seeing lack of development, brain development issues, and these are lifetime factors that affect a child.
Can be very serious. Thanks for making that point. So, and it's super important that to understand that while it's common, it's not normal. You have a great walk coming up Saturday, September 21st at 10 a.m. The Womb Room MKE is on West National Avenue. That's where it kicks off. Again, it's at 10 a.m. You can find out more by visiting them on Facebook. Ladies, thank you so much.
Thank you.
Thank you.
Appreciate it.